morning, good afternoon now, everyone. Thanks for joining me today as we bring you our latest webinar, Autism and the NDIS. My name's Isabella Hunter. I'm one of our business development associates here at Plan Partners. We'll also do a proper introduction for our panel shortly, but joining us today is Nicole Hurley from Autism Awareness Australia. And then we also have Rolly Pontagon, who's going to assist with questions and anything that does come through on the chat function. So today we will discuss some of our tips as a plan manager for you to assist with participants who are on the NDIS, and as well as some of Nicole's experience dealing with the NDIS and autism too. We will have that Q&A session included as well. If there are any burning questions, please pop them into the chat function. And just for timing purposes, if we can't get to everything, we'll put our partnerships email on the slides as well as Nicole's autism awareness email. So if you do have any other questions, just please send them through there and we'll be able to do that individually afterwards too. Following on from the presentation today, we will send a follow-up email with information from both Plan Partners and Autism Awareness. So feel free to distribute this where you feel fit. And just before we do get into it, we do want to make an acknowledgement of country. We acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. And we pay our respects to them and their cultures and to elders past and present. So today we are exploring one of the largest growing segments within the NDIS. But firstly, I'll pass over to you, Nicole, if you're able to just take us through your experience and who Autism Awareness are.
Thanks, Isabella. Hi, everyone. Good afternoon. My name's Nicole Hurley. I head up the partnerships and fundraising here at Autism Awareness Australia. We were founded in 2007. We're a not-for-profit charity. We are not a service provider, and we provide free, credible information and resources to autistic individuals and families. And we do events, fundraising, webinars, educational programs, and we have a lot of fun along the way. Our goal is to improve the lives of Australians on the autism spectrum and the families who love them. So I'm really excited to be here today to talk to you about the NDIS.
Amazing. Thanks, Nicole. So just to quickly take you as well through Plan Partners. So we do provide plan management and support coordination services for NDIS participants across Australia. We do want to look at taking a holistic approach in all aspects of services. So we also, on top of course, taking care of our participants, make sure our support coordinators and providers are looked after too, just to be able to get the best out of the NDIS. So we can be contacted through phone, email and live chat. We also have a business development lead in every state. So you do have that direct point of contact as well for you and your teams. We'll pop the details into the chat as well at the end of the session. Just to get started, so when it does come to funding and having kids set up onto the NDIS, we will say they would normally be beginning in the ECEI space. So that's the early childhood intervention. This is between 0 and 6 age group. And we generally do find that it looks more to sort of therapy-based services. So anything like speech therapy, behaviour, physiotherapy, with the aim to assist and support and get those things in place from the very beginning. And those therapy supports, they're going to fall into your capacity building category. So generally category 15. And then you've also got the other types of supports or things that you could get funded, sensory toys, weighted blankets, noise cancelling headphones. So that's where you've got your core supports, and that comes into there sort of under category 3 or consumables for products. Keep in mind as well, things like those noise cancelling headphones, similar to iPads and things, you can actually get them funded through Officeworks and our partnership with them. So wanting to take away that admin side and making it a lot easier for you as support coordinators and providers too. Another thing I will pass over to you, Nicole, just to have a little talk about ECI to NDIS and sort of your experience with that transition over as well. So I'll pass over to you.
Yeah, absolutely. So I'm a parent of a child who is in the NDIS. When we first started, he was 4 when he was diagnosed with autism, and we had no idea what NDIS was. So it's been a big learning curve. We've learned a whole new language, but it really, our advice is to all individuals and parents and carers that do receive a diagnosis is depending on the age of your child or yourself, it depends. The approach is very different. Like Isabella said, under sevens will go through the early childhood approach, and once they turn 7, they have to then transition from that local area partner into the NDIS and through local area coordinators. That can be really confusing. We've got a lot of information on autismwhatnext.com.au, which is one of our platforms, and it really takes you through step-by-step guide of how to engage with the NDIS. You can get a curated pathway of what to do next, depending on your scenario and situation, and really help, debunk a lot of the jargon that's in the NDIS. We were quite overwhelmed with the process. It can be long and forms and more forms, but also then the information that you have to provide to prove why you need the funding can also be a mind shift from showing worst case scenario of yourself or your child.
Yeah, absolutely. Thank you. We do have on screen, so the 3 ways to manage funding. I know everyone here will be across all of these, but I do think it's important just to recap, I guess, some of the differences there. So for self-managed, so you've got your participant or parents taking care of their own invoices and funding. They don't need to look at following the price guide when it does come to services. So that can be charged. They can be charged whatever is agreed upon by the participant and the provider. And then you've got your NDIA managed. So that means that the participant has the NDIS managing and paying for those invoices. And you do only get access to providers who are NDIS registered too. So for the plan management, so that means having someone like Plan Partners to take care of all of that. Plan managers look after your invoices. They make sure payments are done in a timely manner. But it also does give the comfort of knowing that there is a price guide to follow and you aren't being overcharged on anything. And it also does leave that door open for both registered and unregistered providers too. I was going to say, I am definitely a little bit biased, but I do think plan management can save a lot of time for families. It's definitely not uncommon to have multiple kids on the NDIS as well. So it's definitely that time saving aspect as well. Rolly, did you want to add anything onto that as well with the plan management and self-managed?
Definitely. I guess every journey is different. I think it's going to come down to your preference and what fits you in terms of your goals and aspiration and your support and services need. For someone who's got family members as well in the spectrum, in our experience, I suppose I remember when the first plan was given to us and it's agency managed. And we needed to access the speechy, which is just 2 streets down the road. Now the speechy is not registered. We had an OT in place as well. Again, OT didn't hear about the NDIS until recently. So I guess one of our early learnings is that if you have existing clinician or relationship with an allied health, especially with children, you want to sort of stay connected and maintain that continuity of support and services. It's really important that sort of you understand the difference on how your plan is going to be managed. And obviously in this case, we've up to plan managed. I think 2 of my cousins are plan managed, 2 are self-managed, which is quite interesting for reason Bella has highlighted. But for us, it was really sort of having to tap into. I don't really like using the word non-registered because it had some sort of slightly negative connotation around it. The reality is some of these non-NDIA registered provider just means that perhaps they're private practices. A lot of them are in the small, medium-sized private practices in your local area and probably don't have the time for the requirements to submit a registration because that could take some time. But there's also an audit requirements around that. So it's really crucial that sort of the difference. And I guess not just in plan management, this is also extending self-management around having to tap into unregistered provider. And then probably of late, there's a lot of innovative disruptor sort of new practices, if you like, not just in the clinical aspect, but non-clinical. And when I say non-clinical, these are your social community participation. I think there was an equine that was mentioned before, a lot of social interaction to build the capacity of the participant. Again, sort of having that option of having to link yourself to an unregistered provider and registered provider.
Yeah, absolutely. Thank you. We'll jump into some question time. So obviously you've heard a bit from us already, but we do want to pass over to you, Nicole, sort of as our expert and also as a parent of a child with autism too. Rolly, was there anything in the chat to call out as well before we get into these questions that we have?
A lot of question from the last one from Michelle around cost around agency registration. I might chime in and then I might just get Nicole's take on this. Look, the reality is applying the registration takes a lot of time and preparation around your credential, your capacity and experience. So that's a bit of a administrative sort of requirements, right? I think what you're referring to, Michelle, is perhaps some of the audit that happens later on. Depending on how many registration you're applying for to be NDIS registered, that is obviously subject to the governance structure of your policies and procedure and practices. So there's a lot of time. I did plan partners registration in the NT, for example, and there's an emphasis on cultural competency. And I think it took me 13, 15 weeks to get a registration, and I'm glad that it's now national. Back in the early days, it's different jurisdiction. So I guess cost varies around time and resources, and that's the point that I was making before. Like the speechy that my cousin is accessing, like she's a one-person operation, right? So she's got local clients, doesn't really have the capacity to sort of go into that journey. It doesn't mean that like participant is not going to be able to access her service, especially with the relationship, because she's been looking after like our family member for a while. So I guess it's a case-by-case basis in terms of your resources and time, but certainly there's a cost involved in the what they call certification or surveillance audit that happens later on. So, Nicole, do you have any insight on that? Like, what are you hearing from the advocacy sector around sort of I guess cost around registration?
Yeah, same things that you've said. So some of the service providers that we work with, there's a lot of time, money, and effort to get registered. So I think looking at resources of how to do that best, cutting down your own legwork and time. Go on to NDIS, have some great resources as well. But yeah, that's what we hear as well.
Yeah, definitely. Thank you. And Nicole, just with some of your experiences or what are some of the hurdles that you've had to overcome, I guess at the start of your NDIS journey, or anything that you were sort of in the dark about that you wish you knew when you were getting started?
I've been dark about everything,
yes.
Particularly NDIS, and that's something that we hear from our community a lot. It's like learning another language. Depending on where you live, will depend on who your local partner is. So you've got to understand that. We had to go to the Cerebral Palsy Alliance, and that was very confusing for us because we'd just gotten an autism diagnosis, so no one had really explained that. So autism.next.com.au really has that next step, so you can put in a curated Q&A that says, I've just received a diagnosis, it's for my child of said year, this is where I'm up to, and you get bite-sized information, not too much, because you don't need to know the whole of NDIS as you join. You just need to know what you need to get a plan, then preparing for your plan, what do goals look like, simple things like that. I've been in the corporate space for 20 plus years and I know how to write goals, and then an NDIS goal is very different. You've got short, mid to long term, and that can be very different, particularly when having to write from a worst case scenario. So there's a big learning curve for everyone. From a service provider perspective, you then, who do you go to? Who's reputable? Asking a lot of questions, joining a lot of groups, getting credible resources to work out who your team's going to be for your child or for yourself. There's also, we leaned against a social worker that we already had in our team for my son because we just didn't know what we needed to do, and she really helped us formulate that first plan, and then from there I'm able to now do that for him year on year. But it's really great to get advice and expert advice as well.
Yeah, absolutely. And what would be some of the, I guess, common challenges that do facing service providers who are supporting people with autism as well? I know capacity is such a big issue in this industry. So
Capacity. So experienced, incredible staff, and that not only affects the service providers, but the families and individuals who are trying to get services. Obviously with COVID as well, and even just general sickness these days, staff availability and being able to run appointments. I think also in that space, they really need to understand autism. So going to credible resources like ourselves, to the NDIS, to plan managers, to really understand what is autism, and what are the questions to ask a family. Really needs to suit the family and the individual. So starting off with their needs, so you can tailor support to them is really what really they're going to be up against. Efficacy and evidence is really one of them for individuals and families to look out for. There's, like you say, Rolla, there's a lot of service providers coming out, and it's not just traditional early intervention, but there's a lot of support and play, and you really got to look at what are the goals, what can they actually effectively deliver that will help yourself or your child.
Yeah, absolutely. And I guess it sort of does lead into what you were saying before, but how can service providers be creating a safe space for children, like anything from the weight rooms and things like that? What do you say to that?
Yeah, and again, it comes down to the needs base of their clientele and their families. But definitely when you're looking at in clinic, it could be social stories. It can be, what does the waiting room look like from a sensory space? It can also be, we've got a therapist that they're very known to run late. And if you've got those end of day appointments. So waiting an additional 30 minutes in a weight room is just hell, really. So giving effective communication beforehand, which means I can take my son to the cafe next door or to the park across the road. So effective communication both ways is really big. Looking at accessibility needs, a lot of autistic people have other co-occurring conditions such as CP, etc. So really looking at a whole of clinic experience. But like we know with COVID, telehealth, you need to look at different ways to deliver sessions. In clinic's not always 100% option. Families, everyone's busy and you need to work in with families. So in school, out of school, in home, telehealth, particularly for our rural and regional families where services just are non-existent, and getting to metro major cities just isn't possible. Even if you're in a metro city, you need telehealth options, because every day you're able to make it before or after school or during school hours. So that flexibility for family needs is really key.
Yeah, of course, definitely. Thank you. And Rolly, was there anything else just before we do move on from the chat section to be able to get to?
I'm not sure if we want to go down this road, but there's some really intriguing, controversial question. For example, there's a comment around swimming, that apparently that the NDI or the planner or the LAC have started to decline that. There was a good response there from, I think, one of the EP. So I guess off the back of Nicole's point, just as an example, and this is a live experience. So Gabriel, one of our family member, was on the spectrum. He's now 19, and he's really he came to us and he said, look, I'm done seeing my psychologist and my OT. I feel like, it's the same thing again and again. And he wanted to focus on building relationship, like social interaction, social community participation. So whilst we have not ceased accessing allied health, because we believe in evidence-based, health-based practices, that's really important to the clinical aspect of his journey. What we've added is a lot of this social community participation activity. I think the language is crucial here. So when example is being given to us, especially from a plan management perspective, swimming, horseback riding, equine, you really need to understand and look at the goals and aspiration of the participant, the assistance and support and services. Of course, why should the taxpayer pay for someone's swimming lesson when we all know that it's all subject to reasonable and necessary? But of course, with the recommendation of your OT, working with your team of clinicians around the participants' goals and aspiration, and the goal is, for example, to build that social connection, to build muscle toning and resilience and exercise. We know that better physical health and better mental health is really an important aspect in the clinical therapeutic approach to supporting participant in the spectrum. So Yeah, so I guess, Nicole, like, so what are the examples that sort of, you know, from your advocacy work, some of the social community participation to I guess, go hand in hand with still seeing a speechy, the OT, the EP, the physio, the psychology, that you've seen in your
Yeah,
in your
absolutely.
interaction with the community?
Yeah, like you said, there's been a real uptake in community and social and also sport participation. From our perspective, we really wanted our son to be into sports, not only from a social perspective, but physical and being part of the community. So we got funding to do a program called Sense Rugby to try that. So it's from an OT perspective. So you can find organisations that have that sort of core type therapy from an OT perspective, but then delivering it through a rugby lens. And that was then able to help him transition from that into the local rugby club. So we don't have funding to go to the local rugby club, but it was a stepping stone that we could use the goals of OT, participating in rugby, passing the ball, but getting the OT benefits from physically and a health perspective to then move into a community sort of play area. So there's different ways in which you can, you know, slice and dice it. And I know that it's not consistent across the board. Some people might get swimming, some people might get denied. It really is, there's no consistency in the results. If in doubt, always raise it with NDIS and dispute. Very big advocates to, if you're not getting what you want, then go through those channels and dispute your plan and the outcomes.
Yeah, of course, definitely. Thank you, Nicole and Rolly. Nicole, I know you've mentioned before about Autism What Next. Was there anything you wanted to add about this this tool that you've got online for people to utilize?
I'm so excited about this tool. We launched it last year, and it was funded by the Department of Social Services, and it was written by parents and carers, autistic individuals, and Australia's leading clinicians. And it's basically a toolkit that hugs you and catches you in that first 12 to 18 months of seeking a diagnosis or receiving a diagnosis. There's such rich content from videos, infographics of people that have walked the journey before you. It's not only just for parents and individuals, but for service providers, grandparents, everyone can use this. And one of the key features is a pathway. Like I said before, you can go in and get an individualized, curated pathway of wherever you are in your journey, and it gives you a step-by-step guide of what to literally do next, because we're often left to the perils of Google once we receive this information, and there's so much to know and so much to do. Then this gives you bite-sized information, allows you to breathe and work through your journey. So jump on board, autismwhatnext.com.au.
Yeah, amazing. Thank you. I've definitely had a look through that. It's such a wealth of knowledge, so much information.
You might see some familiar faces.
Yes, exactly. Thank you so much for that.
Hey, Bella, I'm just going to chime in because I know this was asked from the previous session. So just to let you guys know that all this resources is actually free. It's fully funded. So it doesn't cost the support coordinator, the service provider, the participant, and the sector in general. Ideally, we would sort of engage this sort of session as part of our listening session. So we're seeing sort of pattern from queries from the community. And I guess that's the beauty about the NDIS. You know, we can certainly collaborate with like-minded organization and share resources. So as a disclaimer, all the information and resources that we will share to you today is free, and it's funded, and obviously in the best interest of us sharing our experience, and you can relate to that and able to use some of the tools and resources.
Exactly. Thanks, Rolly. In saying that as well, so as we said, both resources are all free. The one that we've got about plan partners. So, you know, we want to be able to support you as providers and support coordinators who are helping our participants every day. We'll go into it in the next slide as well with our tools, but, you know, letting our participants know if they are overspending, underspending, them being as involved as possible with their funds. So we really want to give that back to our participants too. I know as well, Rolly and I were saying, you know, we work in our partnerships team. So in the chat, if there is anyone who is providing something a little bit different to be able to support ASD, for support coordinators, pop your details, website into the chat for someone else to be able to have a look at afterwards too. Definitely, as we said before, capacity is a really large issue in this industry. So if you do have capacity for anything, allied health, as I said, something different, pop that into the chat too. And as I said, with our tools, So I did want to briefly mention that utilising our website too. So we've got our knowledge centre, a lot of amazing articles just to really simplify and understand the NDIS. So, you know, from anything with invoicing to looking at, you know, different types of ASD therapies like equine and play-based therapies that we've mentioned before. So you can definitely check that out as well. And our budget calculator, I know Rolly uses this as sort of a budget or, you know, planning for the future as well. So really being able to break down, you know, what supports are needed, how much that is going to cost, you know, bring that into the planning meeting and say, you know, it's going to cost me $10,000 per year for equine therapy or play-based therapy, and being able to give that to the planner so that they can get the right funding that you need as well. So it can be broken down over 1, 2, or 3 years, and a really good tool just to be able to support that going forward as well. Price guide navigator as well. So as always, that's just going to be able to show you the price limits, you know, how much is in the price guide, what it covers, and a description of what each one is, as well as quote required or stated too. Our dashboard as well for our support coordinators and providers. So as I said, keeping up to date with invoices, the funding that's available, you know, where the invoices are going as well. And also stay tuned as we are updating that and currently working on bringing that all revised. So that will be coming out in the next couple of months too, just to be able to make the best of this online platform. I just wanted to briefly again mention our sign up option. So look, we've got a few different ways. We wanted to be able to make it as, I guess, accessible to everyone as we can. So you can sign up through the website. You can sign up over the phone with a verbal service agreement. So no forms or anything needing to be signed. And then of course your normal paper-based one. So you can email that into us too. And just lastly, before we do end up wrapping up, so we've got our ebook that has been designed for anyone getting started on the NDIS too. So for support coordinators, new parents, more tips and tricks on how to navigate that, breaking down jargon, you know, evidence-based and as well. So yeah, a really good tool that we'll email out to in the follow-up email. I think we've sort of hit time for this one. We've done well this time, not going over, but thank you everyone for attending today's session. A huge thank you, of course, to Rolly and Nicole for your insights, expertise and experience. As always, contact us. We've got our email through on the screen, as well as autism awareness email and the What Next one. So please do check that out. It's a really good tool to have and to look through. Anything else to add, Rolly or Nicole? From the chat?
Probably give the time to Nicole. Yeah. I know she's got a hard exit, but look, we're staying on the line to answer some of your question. But Nicole, any closing comment or?
No, yes. Thank you for having me. It's great to always hear questions in the chat, and if we miss anything, happy to follow up afterwards. But check out autismwhatnext.com.au, and you can always find it on our major site, autismawareness.com.au.
Amazing.
Yeah. If you'd like to invite Nicole and our team as well through your personal development day or through your Teams catch up, so we can dive into some of the specific. I know with sort of 30 minutes toolbox session like this, time can be limiting and restricting, but certainly feel free to ask all the questions you need and send us an invite, and happy to sort of, this is part of our community information session awareness. I think the more that we talk about the different practices out there, the more that the benefit the participant would deliver positive outcome in our community. So thank you all for your time, and as I said, we're staying in the chat to answer more questions. Thanks, Nicole.
Amazing. Thank you, Nicole.
Bye.
Bye. Thanks, Rolly. Yeah, as I said, we've got a few more minutes that we can sort of stay on as well. So we'll get that partnerships email popped into the chat. I might just bring that up. Was there anything else that we can cover, Rolly, while we're here?
Let me put some heaps of good question. We can't even keep up sort of typing. Find it more. So there's a question around sort of adults like being diagnosed. I think the early session we did cover that. I think there was apologies for missing that question. Autism Awareness is a great resource around the breakdown of age as well. So they have early intervention or early childhood approach, and also the younger years and adult. I think I might sort of post some of the link that Nicola's provided for us. I think that's Maria that asked that question. And for those that are actually delivering specialist service in this space, So we did talk about previously around highlighting your credential to communicate and celebrate that. We do have a lot of participants needing support and experience in the space. For those one that are fortunate enough to have support coordination in the plan, excellent, because they have someone supporting them. But there is a lot of participants and families out there that doesn't have support coordination, and they're obviously relying on this as for us to connect them, and that's why we're actually launching some of these webinars to sort of connect the service provider, the support coordinator, the participants and their families to access the right support.
Yeah, definitely. Thanks, Rolly. Look, I've put the partnerships email in the chat as well. If you do want to connect to us afterwards or get in touch, as I said, we can do that individual or to your team. I'm more than happy to connect afterwards as well. We will send out the information, the slide decks, and this recording too. So if anyone has missed it, you can definitely watch it afterwards as well. I think we might leave it there. We have hit just after 12:30, but yeah, as I said, thanks, Rolly. Thanks for your time, and thanks everyone.